How to use the RSV, adverb, flu A/B in COVID-19 rapid antigen combo test. These are the materials included in the kit. Step 1. Wash or clean your hands and make sure they are dry before starting the test. Step 2. Read the instruction for use carefully. Step 3. Take out one extraction tube. Pull off the sealed aluminum foil in the extraction tube. Place extraction tube into tube stand or box tube stand. Step 4. Unpack the swab. Caution: do not touch swab tip when handling the swab. Step 5. Tilt your head back slightly. Insert the swab about 2 cm, at least with the entire soft swab tip, into the left nostril. Gently rotate the swab at least 5 times against the nasal wall. Step 6. Insert the same swab about 2 cm, at least with the entire soft swab tip, into the right nostril. Again, gently rotate the swab at least 5 times against the nasal wall. Remove the swab from the second nostril. Caution: if the swab stick breaks during specimen collection, please use a new swab. Step 7. Dip the soft swab tip into the liquid. Rotate the swab for at least 15 seconds while pressing the head against the inside of the tube to dissolve the specimen in the liquid. Step 8. Remove the swab from the extraction tube by squeezing the sides of the tube together and pulling the swab out to ensure most of the buffer remains in the tube. Discard swab in biohazard specimen bag. Step 9. Screw on and tighten the nozzle onto the extraction tube. Step 10. The tube should be gently shaken by inverting it or by flicking the base for 30 seconds to mix the specimen to avoid the formation of foam or bubbles in the sample extraction buffer. Step 11. Open the foil pouch and take out the test cassette. Place the test cassette on a flat, clean surface. Caution: perform the test within 60 minutes after the foil pouch is opened. Step 12. Add 3 drops of the solution from the specimen collection tube to each sample well of the test cassette. Step 13. Set timer for 15 minutes. Caution: do not read the result beforehand, even if a line has already appeared at control region C. The test results will be invalid if read after 20 minutes. Step 14. Please dispose of the test materials in a biohazard specimen bag with the household refuse. If there are local regulations, please follow them. Step 15. Wash hands thoroughly after test completion. Result interpretation. Positive SARS-CoV-2, 2 red lines appear. 1 red line appears in the control region C, and 1 red line in the test region CoV. Positive influenza A, 2 distinct colored lines appear. 1 colored line should be in the control region C and another colored line should be in the influenza region A. A positive result in the influenza region indicates that influenza antigen was detected in the sample. Positive influenza B, 2 distinct colored lines appear. 1 colored line should be in the control region C and another colored line should be in the influenza B region B. A positive result in the influenza B region indicates that influenza B antigen was detected in the sample. Positive influenza A and influenza B, 3 distinct colored lines appear. 1 colored line should be in the control region C, and 2 colored lines should be in the influenza region A, and influenza B region B. A positive result in the influenza region and influenza B region indicates that influenza A antigen and influenza B antigen were detected in the sample. Positive RSV, 2 red lines appear. 1 red line appears in the control region C, and 1 red line in the test region RSV. The shade of color may vary, but it should be considered positive whenever there is even a faint line. Positive adverb, 2 distinct red lines appear. 1 red line should be in the control line region C and another apparent red line should be in the test line region adverb. Weakly positive, the shade of color may vary, but it should be considered positive whenever there is even a faint line. If you have a COVID-19 positive result, staying at home protects the people in your community and you should not visit high-risk settings like hospitals and aged and disability care settings. If you feel unwell or need COVID-19 advice for someone in your care, talk with your health provider or speak to a nurse by calling the Health Direct helpline on 1-800-022-222. If you develop symptoms such as severe shortness of breath or chest pain, call 000-000 immediately. Tell the call handler and the paramedics on arrival if you have COVID-19. If you have an influenza, RSV or ADV positive result, individuals are advised to consult a medical practitioner for follow-up clinical care. Negative. Only one red line appears in the control region C, and no line in the test region B/A/COV/ADV/RSV. If symptoms persist, advice to conduct repeat testing and seek professional medical advice. Invalid. No red line appears in the control region C. The test is invalid even if there is a line on test region B/A/COV/ADV/RSV. Insufficient sample volume or incorrect procedural techniques are the most likely reasons for control line failure. Review the test procedure and repeat the test using a new test device. If the problem persists, discontinue using the test kit immediately and contact your local distributor. The sponsor contact number is 0283281 1008 from Monday to Friday, 9 a.m. to 7 p.m. AEST, or 9 a.m. to 8 p.m. AEDT, or contact us by email address info@sonictec.com.au.